Mental health treatment for adolescents in Orange County, California. The World Health Organization defines adolescence as that unique, informative time in a person's life that begins roughly around 10 years of age and continues until 19 years. During this time, an individual experiences a wide range of physical, emotional, and social changes, which can sometimes expose them to a variety of challenges and other adverse factors. If that happens, the mental health of the individual can be seriously compromised, in some cases even leading to a recognized and diagnosed mental health disorder. Failing to address these issues or delaying treatment can often result in the condition worsening and spiraling out of control, extending through to adulthood. At times, the consequences of an ignored mental health condition in adolescence can have devastating, even fatal, effects. For this reason, it is essential to address these disorders as soon as possible after they first emerge and begin to work with trusted medical professionals to provide the individual with the best type of care and support that can help them to achieve better mental health for life. What do mental health treatments for teens and adolescents entail? Mental health treatment programs for teenagers and adolescents can be structured both as inpatient and outpatient treatments. At Enhance Health Group, we offer our adolescent patients a specifically tailored adolescent mental health program that includes the services listed and described below. Initial intake assessment. To begin with, we meet with you and your child to assess their current situation, challenges, and goals, and get them registered for our program. Psychiatric Evaluation. Next, we proceed with a thorough, highly individualized psychiatric evaluation of your child. This generally involves gathering information on the patient's medical history, academic situation, family history, social and environmental influences, and more. It can also include blood work, urine tests, and a brain scan to rule out any specific physical conditions. Follow-up appointments. Your child will be offered regular follow-up appointments with their designated therapist to assess progress and, if needed, tweak the treatment according to any newly emerged requirements. 2 hours of process group therapy per day. Our program also includes 2 hours of process group therapy every day. This can help your child to discuss their specific issues in the supportive, confidential setting of a group of peers. 1 hour of Psychoeducation Group per day. In parallel, we are also offering daily psychoeducational sessions to help improve your child's understanding of their mental health condition. Nursing assessment. Our on-site nurses will also be available to carry out a regular nursing assessment to ensure that your child's situation and progress are always addressed appropriately. 3 aftercare planning and referrals. Once your child has been discharged, they will receive a specialized aftercare plan, which includes referrals and sessions to ensure the ongoing monitoring of their mental well-being. Family engagement and support. We highly value the engagement and support of our young patients' families, which is why we strongly encourage that you and the rest of your family are as actively involved as possible throughout your child's treatment with us. Our intensive outpatient adolescent program. Our program is geared toward assisting adolescents that struggle with mental health or behavioral issues. We aim to empower your teenager with the tools and resources they need to be complete, happy, and to have a rewarding life. Our intensive outpatient program couples dialectical behavioral therapy, DBT, and cognitive behavioral therapy in group settings. We aim to provide participants with effective stress management strategies, skills to reduce emotional distress effectively, skills to challenge beliefs or schemas that negatively impact thoughts/feelings, and knowledge of how we relate to ourselves and our peers. How can teens and adolescents benefit from mental health treatment? The high level of emotional resilience and adaptability that most adolescents display can be the key to successful mental health treatment. Teens and adolescents, therefore, can benefit from receiving this type of support in a professional setting as they can feel connected, protected, and cared for. An expert adolescent mental health program delivered by a skilled healthcare professional will also help your teenager to minimize feelings of shame, isolation, and judgment, while at the same time increasing their self-esteem, confidence, and self-acceptance. Which disorders can be treated through adolescent mental health programs? A wide range of mental health conditions can be successfully treated through adolescent mental health programs, as we are explaining below. Behavioral disorders. These can begin to emerge earlier in childhood and become particularly prominent during the initial teenage years. Such disorders include attention deficit hyperactivity disorder, autism spectrum disorders, and conduct disorders. Our top priority is helping our community get the care it needs to stay well. We work with all major insurance companies and can help guide you to affordable care. Dangerous and harmful behaviors. Also known as risk-taking behaviors, these include drug and substance abuse, sexual risk-taking, heavy drinking, and violent behavior. Eating disorders. While generally, people tend to identify eating disorders exclusively with anorexia nervosa, these are much more complex and multifaceted and also include bulimia nervosa, binge eating disorder, pica, rumination disorder, and avoidant or restrictive food intake disorder. Our top priority is helping our community get the care it needs to stay well. We work with all major insurance companies and can help guide you to affordable care. Emotional disorders. This category of disorders includes anxiety, depression, obsessive-compulsive disorder, post-traumatic stress disorder, and other mood-related disturbances. Psychosis. This is one of the most concerning types of adolescent mental health issues, as it involves hallucinations, delusions, and other symptoms that can be conducive to fatal consequences, including suicide. Self-harm, suicide ideation, and suicide attempt. Adolescents who practice self-harm can utilize both their bodies and external tools and means to self-induce pain, which can sometimes be very severe. Suicide ideation and attempt in adolescence are very concerning situations that must be evaluated, addressed, and treated through specific mental health programs. Thanks for watching our video. For more information, please visit our website enhancehealthgroup.com.